Hi, everyone. Thanks for joining us today for our November 19th Stay in the Know webinar session on exploring the HealthInfoNet Academy platform to gain key insights. My name is Chad McLeod. I am the Director of Product and Communication at HealthInfoNet, and I work with our clinical education team that is led by Nicole Yeo-Fisher and Sharon Bearer to bring to you our participants in their end user communities different education and training opportunities that meet various needs. And so the point of today's webinar is to talk about some of these new opportunities and specifically honing in on our new and redesigned HealthInfoNet Academy platform. So for today's session, we're going to start with a slide deck because what's a webinar without a PowerPoint, to give a brief overview of the HealthInfoNet Academy platform, show you some of the key components of it and what we hope that you guys might be able to gain from it. And then we'll actually dive into the Academy website itself to give you a demonstration on its use and some of the different functionality and features that are offered within it. And then because today's session is going to be fairly short, I expect that it will be maybe a half-hour in length. I would like to maybe have some engagement opportunities for you all to provide us with some feedback and suggestions. So I'm sure you're all familiar with Zoom polls nowadays, we're all in our virtual worlds, but I'm going to be throwing out some Zoom polls, and we're going to start with our first one right now. And so let me bring it up. All right. So on your screen, you should see a poll that says, have you ever used HealthInfoNet Academy before? Just a quick poll to say, yes, I've used the new site. Yes, I've used the old site. Or no, I've never used it before, just to get a quick sense of where we all are in the room. All right, give just a second more. All right, super. So I'm going to end the polling and show you guys your results. So about half of you have never used the Academy before, so this is great. And some of you have only used the old site. So there's a lot that we can learn today, and I hope that there's some important feedback and uses of the Academy that you can use going forward. So we'll stop sharing the results. And I'll exit out of that. Great. So just quickly, like I said, going to go through a very
Chad,
few.
the poll is still up. I don't know if folks can see that.
You might have to exit it out individually, okay. Nicole. Yeah.
All right, perfect. Thanks.
If it is still up for users. Yeah, thanks for calling that out. So let's see, just a couple of quick housekeeping in case folks are not familiar with HealthInfoNet. We are the state's designated operator of the Health Information Exchange. If you're not familiar with Health Information Exchange, we are the connector among healthcare facilities' electronic health record systems to make sure that we can create a comprehensive electronic medical record for each patient in the state. So we've been doing this for about a decade now, and we have over 850 participant locations that are connected to us throughout the state. So we're able to tell a really interesting story about our state's patients and their medical histories. We're an independent nonprofit. We're governed by a community voluntary board of directors that are made up of health systems, medical providers, public health organizations, and various other businesses located in the state. And what we do with our patient medical records is that we create really interesting services with them. We have our clinical portal, which is our primary patient medical record system. We have notifications for various patient events that folks can tap into. And then we also work with the CDC on public health reporting, and we do predictive analytics and measures as well. For today's session, the key of it is talking about what's included within the Academy itself. This is our educational learning platform, and there are 6 key components that make it up. The first are online full-length videos and tutorials. And so they're online based, and it's basically ways that folks can take away resources and learn about the HIE's systems and tools on their own time. We do have one course that provides continuing nursing education credit in case folks have that opportunity. But the other courses aren't, and they're as a result, a bit shorter. They're mostly between 20 and 45 minutes in length if you were to walk through each of the videos in their entirety. And so they do offer a very good grasp and in-depth view of our systems and tools, and we'll preview what those courses currently are all about. Though we recognize that not everybody has time for 20 to 45 minutes and sitting down for one single session, although you can pick it up at any point in time. So we've been creating very brief video use cases and tutorials on how to more effectively use the HIE, and they're 1 to 3 minutes, and they're curated by Nicole and Sharon, and they're tips and tricks that we have found they're useful in our own use of the tool and demonstrations of it that we thought we'd offer to all of you as well. Third are our Stay in the Know webinar series. That's what we're all doing right now. We host them on a monthly basis. It's typically the last Wednesday of the month. November and December are a little bit different just because of the holidays, but you can guess that the last Wednesday of the month we'll hold a webinar, and we typically send out notifications for them several times in the month leading up to it. We also have a communications package. This is for new participants as well as existing participants to be able to read through a variety of materials that allows them to better understand the use of the HIE and communicating the use and value of the system to both internal staff as well as to their patients. We have training resources, so if you become an authorized end user of our systems, we have a number of online resources that you can print off and take away with you to have by your side, whether they're user guides, technical appendices, informational one-pagers, or whatnot. We'll show you where those live on our site as well. And then lastly, when all the virtual world that we live in, maybe not meeting your exact needs, we still have myself, we have Sharon and Nicole, and other members of our team who are always willing to write an email, pick up the phone, or have a Zoom chat with you to get you exactly what you need. So that one-on-one support, although we're working virtually and can't be in person nowadays, it's not lost. And so we always invite you to contact us. And a good inbox to reach if you have literally any question, whether it's to say hello or you have a problem or a bug that you're trying to fix in the system, it's clienteducation@HealthInfoNet.org. That will get you a direct line to Nicole and Sharon. So with that, I'm going to open up a new poll. And we want to know, how do you and your team learn best? Is it in those full-length online courses? Do you like the brief video use cases and tutorials? Or is it webinars like today that give you more value? Do you like printed materials? Or do you like that one-on-one support, picking up the phone and calling a member of our team? This really helps us better understand how we engage with you going forward. So I'm going to give that a second for folks to pick and choose. I think you can choose more than one option if you'd like. All right, things are moving. Look at all that. I'm going to end the polling in 3, 2, 1. All right, and I'm going to reshare. Okay, so you guys should see that in your screen now. It's a mixed bag. It's really interesting. So you like what we're doing today with webinars and scheduled programming, maybe an hour to eat your lunch and learn something new. But then there's a pretty good distribution of how folks like to interact with us otherwise. So thank you. That's really great. So I'm going to stop sharing the results, and if the poll continues to stay on your screen, feel free to exit it out. All right, super. So before we dive in, just a couple more things that might be of interest to you. The first is that who uses the Academy? And when Nicole and I were talking about this slide earlier, we thought, oh, geez, nobody's going to want to look at all these pie charts and match up the legends to the colors of each pie, because there's a lot here. And we thought about ditching it. But you know what? I think this tells the story we're trying to make here. It's that a lot of different people use the Health Information Exchange, and they use our our HealthInfoNet Academy platform to educate themselves on the use of our data, tools, and services. And so, if we just pick out some quick high-level stats here, by organization, hospitals, outpatient facilities, pharmacies are big users of the Academy in order to educate themselves on it. And then in terms of the people within those that are working by job title, we see that billing, we see medical assistants, as well as registered nurses as being some of our top utilizers. But sprinkled in between there are all those other different jobs in organization types that are leveraging the tool. So whether you've used it or not, and if you can see yourself in one of these organization types or job titles, know that there are others here. And if you're not reflected here, we'd love to know where you come from and who you are, and how we can help maybe curate our tools to your specific interests. So with that, I hope you're not getting poll fatigue. We've got another one. All right, this one's simple. Based on what you know about it right now, the high-level overview of the Academy, does this seem like something you guys might be able to utilize? Does it seem like you could share this tool with other members of your team to educate themselves on the health information exchange? So we'll let this poll run out for just a second. All right, you guys are getting quicker. So I'm going to end the polling right now. I'll share the results back to you. All right, so we got 12 yeses and 1 no. So I'm going to try to persuade the no by the end of this call to see if it's maybe something more useful to you guys. So we'll end the poll. All right, great. Moving on. So just to recap, who's behind the Academy? Sharon Bearer, Nicolio Fisher, they're the masterminds of the Academy. I'm taking the credit for it today. They're the voices that you'll hear. They're the ones that are constructing the courses and the materials that are provided throughout the Academy that I'll show you shortly. And so, again, you'll hear them throughout the different sections that you visit in the Academy, but also these are the 2 individuals that will be working with you if you decide to reach out one-on-one. I mentioned the client education inbox before, but here are their emails and telephone numbers where you could pick up a line and directly get in touch with them. I'll plug, we do have new office hours. So we realize that folks are virtual. We can't be in person with you. Sharon and Nicole would be on the road maybe half of the year visiting your organizations if we weren't in the COVID pandemic, but that's no longer an option for us. And so we know sometimes it's hard to make the point to write an email or send us your thoughts if you have questions. So every first and third Wednesday of the month, Sharon and Nicole and myself are available from 8 to 8:30, 12 to 12:30, and 6 to 6:30 for open office hours. You can drop in, ask a question, help us or have us troubleshoot a problem for you, say hello, anything that's on your mind, feel free to drop in. We've had a couple onesie-twosies over the last couple of months where people are they have a quick question about patient consent. They can't find something in the clinical portal documentary that they'd expect to be there. It's a 5-minute question and answer that can be resolved, but ultimately can help you better utilize the tool going forward. So mark your calendars. What we do is at the end of November, I'll send out an email with the office hours for December. You can mark your calendars that it's the 2nd and 16th of the month, and I'll send out the Zoom links for then. And lastly, if that's not enough, here are all of the various ways that you can get in touch with us. It's the Academy. We send out blast emails. If you're a user with us, you're already getting those emails. If you're a user and you're not getting our emails, it may be the case that the email address is being blocked as spam. So feel free to take the general@infonet.org and mark it as non-spam account. If you're not a user, go to our news site and subscribe to our distribution list. It's as easy as that. Again, drop us a note via email or come into our office hours on a monthly basis. attend these webinar sessions. We do these every month, and we try to tell you about the new things that we're doing. So this is a good forum to do that. And then social media, as you're thumbing through your news feeds, we're on Twitter and LinkedIn, and we're kind of in the back of your mind if you follow us there. So feel free to give us a like on Twitter and LinkedIn. And with that, I've got 2 more polls, and then I'll stop doing polls. But let's see. This is really interesting and helpful feedback for us. The first one is, all right, what's the best way that we can communicate these new educational opportunities to you and your organization? We realize that emails are difficult, to sleuth through, but to blast emails or do personal outreach from Sharon and Nicole work better to grab your attention? Do you like things posted on our website? Social media good? Or again, are these webinars a good forum for you to catch up on everything that we're doing? Give you guys a few seconds. All right, and we're ending. I'll share you guys what you said. Yeah, so interesting. We got a tie for if you like the blast emails and you like the webinars, that's good. That's what we're doing. So we won't change that. And then we can continue to make that personal outreach as well as just post things in a place that you guys might go to regularly to find out information about us. So website and social media. Great. So I'll stop sharing those results. And I've got one last poll for you guys before we get into the demo. So that's how we can touch base with you, but how can you touch base with us? So how do you prefer to ask us a question? Do you like to send us a personal email? Do you like to pick up the phone and call us? Do you like to maybe try that office hours that I mentioned earlier? Or would it be helpful to have a place on our website where you can always go to put in a kind of a question and for us to follow up on? What works for you guys? All right. They're still moving. Ending the poll in 3, 2. All right, good. So let me share this. All right, you like personal emails. So your preference to reach out to us is dropping us a line to Client Education or to Nicole and Sharon directly. But telephone's a close second, maybe something on the website third. Then those office hours, a novel idea, but maybe they're not the preference. So that's really helpful. Thank you. All right, stopping to share results. Feel free to close that off your browser. All right, so with that, we're going to dive into the Academy itself. All right, so you should now be seeing my browser that has the HealthInfoNet Academy site. Nicole, if you can't see it, let me know. We can bring it up separately. All right, great, thanks. Okay, so I'm going to go from the beginning to the end, give you guys a quick tutorial of what's included here. And so when you come to the site the first time, you may not have ever been a registered user. There was overwhelmingly folks on the call today that have never used our Academy site or maybe have never logged in. And so when you come up here, there's going to be a sign in button. I'm signed in, but it'll look like this, a link to sign in. They'll bring you to a page where it asks you to use your already provided credentials. If you don't have an account, there's a link at the bottom to create a new account. We just ask that you tell us a little bit about yourself, your organization type, your job title, where you're coming from, and then you're in. And once you log in, you're going to have in the upper right-hand corner, your name is going to present there. So that's how you know that you're logged in, and you're good to go at that point. And so it's going to bring you back to the landing page. And this is really just a quick overview of soup to nuts, what's included within the HealthInfoNet Academy site, a little overview for you guys, some teasers for us to pitch, why should you use the Health Information Exchange? How are other people using the Health Information Exchange? We put user testimonials that we've compiled over the years, just so you guys can read through it. And maybe there's a face in there that you recognize that you could say, okay, if they're using it, maybe it's a good tool for me too. we show you some of the courses that we provide. This is just a preview. We're going to show you all of them in a minute. And then down here, you can just click back to our website, our corporate site, if you want to pick around there as well. The all courses, this is our full-length video-based tutorial courses. If you've ever used our old HealthInfoNet Academy site, you're most familiar with 102 Clinical Portal Overview. That's the one that provides the CNE credit. If you've successfully gone through the entire site, done the quiz at the end, you would have gotten a certificate that gives you with a 1 CNE credit. However, since we've redesigned the platform and launched earlier this summer, we've added 3 more courses. And so whereas 102 walks you through the point of the Health Information Exchange, and specifically our clinical portal application, the next one, 101, is that communication package that I mentioned earlier, which is just a number of materials that Nicole and Sharon use when we onboard new organizations or refresh existing organizations to tell them a little bit of everything that we can about how the tool is valuable and how they can use it to both internal staff as well as the value for patients as well, as patients begin to make their consent choices to provide their data or not to the Health Information Exchange. Just like a college course, the 100s are things that maybe everybody should know. As you get into the 200s and 300s, they get a little more specialty and maybe not as applicable to every individual end user. So 200, this is our in-context application. If you haven't heard me talk about this before, we found a way to embed our Health Information Exchange directly within an electronic health record system like Epic, Cerner, Athena, so on and so forth. And so if you're used to our clinical portal, you know that you have to go out to a different browser, log in with a username and password, and then get access to your data. Whereas here, if you're in Epic, for example, and you look up Chad McLeod as a patient, up will pop Chad McLeod's record within the HIE as well on the right-hand side of the screen. So embedding that resource more tightly, and this is the course that provides an overview of the features and functionality. And then lastly, you have a 300 course, and this is where our 300 course series, if you will be a case study. So different ways that specific types of organizations and users can leverage our tools to their specific benefit. So in the month of October, Nicole and Sharon did a ton of outreach to our long-term care participants, giving them a better understanding about how they can use our tool. Our upcoming campaign is around specialty care. And then we have many other campaigns moving forward. So you can imagine that as we get these under our belt, we will add additional courses here. Now, even if some of these courses aren't particularly pertinent to you and your organization, it still might be of interest to kind of rifle through them really quickly. You can skim through things to see if there are any ideas that you see there that may be applicable to you. So as an example, if you find a course you like, you can click on it. I've subscribed to this course already. And so when you click on it, it's going to give you a little bit more information about what we hope you'll take away from it after you're through with it. You can preview the course curriculum and the lessons. This gives you an idea of how much is contained in it. And then you can enroll. So if you click on the enroll in course, it'll bring you to the actual course for you to take. Now, I've already enrolled. So when I do it, it's going to say, oh, you've already done it. And it takes me to my dashboard. And so what my dashboard is it shows me all the courses that I've subscribed to and that I've started and my progress in them. You can see I've started all, but never finished one. So if I click on long-term care as an example to finish, it'll open up the educational platform where each of the chapters has its own drop-down menu. And if you click on a particular chapter, within that are lessons. So for example, the one I have now is a video lesson, and you would listen this through. And then at the end, you would click complete and continue. And it would bring you to the next lesson in this chapter. And this one is text-based. So we give you some other options for you to look at. So you can look at our clinical portal user guides that have been designed for long-term care. You can listen to some end user testimonials that we've received. Then we create some PDF materials about, again, just high level, how can you use this tool, as well as our contact information at the end. Now, again, this course in particular doesn't provide a CNE credit, but others do. So if you come to the end of it, You would take a quiz, and then you would get a certificate that you could print off for yourself. When you're done, you can go back to the dashboard because there's maybe still some helpful resources for you. Again, those are full-length courses, average between 20 to 40 minutes. You can also go to clips. These are things that you could just listen to 1 to 2 minutes. So how do you use our COVID-19 notification services? How do you use recent patients' work lists, clinical document trees? Do you want to listen to some more end user testimonials? You could do that as well. You notice that these are all YouTube. If you're not subscribed, but you like YouTube, you can always subscribe to us. And that way, every time we push something out, you'll get a notification. There's also resources. And so here's where you can contact us to receive our communication package, where you can click to view our YouTube playlist. So if you click here, it'll bring you to the playlist of all of our webinars that we've hosted, and then you can watch any one. You can also look at our supporting documentation. So this will bring you to our training and material site. So for different applications that we offer to our end users, here are our printed materials that they could leverage. And then again, if you forget today's webinar session, you can learn a little bit about Nicole and Sharon, who you'll be reaching out to and interacting with, and then you can grab their email as well. As a whole, that's the basic components of HealthInfoNet. The remaining menu items are really just to link back to our HealthInfoNet corporate site. If you want to use some additional information about who we are and what we do, you can always find some more information there. And then you can contact us. So drop us a line by entering your details into the form, and we'll get right back to you. But otherwise, that's the HealthInfoNet Academy. It's really just us trying to provide you with some online-based learnings now that we can't touch base with you in person. So with that, I just got under the gun for a half hour, so I'll pause. I'll see if there are any questions. Folks can feel free to come off mute. You have to do that manually or drop us a line in the chat box. Otherwise, the materials for today's session and all of the different links that we talked about will be sent to you all via email. So keep a lookout for that blast email that we sent. And if you have any questions in the meantime, again, feel free to reach out to us. So thank you for your time today. If you don't have any questions, you can go grab some lunch. If not, we're on the line for the rest of the half hour if you'd like. So thank you again.